In this video, we're going to take a look at how to save money on health insurance. With the rising inflation worldwide, we should be focusing on saving money whichever way possible. In addition, saving money in various expenses we make can be invested to earn passive income and achieve some financial independence. One of the places where we might not be taking a good hard look in order to save money is on health insurance. A few findings also reveal that one of the major reasons for bankruptcy in the United States is healthcare costs. It is often said that almost 1 in every 7 adults is unable to pay their medical bills within 12 months. With all these reasons, people are looking for ways to save money on health insurance. But how can we really do that? We'll take a look at that shortly, but before we do, we'd like to let you know that we bring these videos to you for free. If you can help us in our endeavor to bring these videos to you by subscribing to our channel and hitting the notifications bell. Also, hitting the thumbs up button will also encourage us to make better videos. If we're all set, let's take a look at how we can save money on health insurance. Number 1, which plan works the best for you? There are various things you need to consider to be a good judge regarding which plan is the best for you. Some people wrongly assume that the higher the price tag of the insurance, the better it is. But that is not always the case. You need to take in the expenses of the family and other needs before you set your sights and decide on a particular plan. There are some families or members within a family who tend to visit the doctor a lot more regularly than other families do. If such a family chooses to opt for a low premium or high deductible plan, they might end up paying a colossal amount. Although making a projection of every emergency you might have or the amount of medications you might have to take is well nigh impossible. It is always good to calculate the number of appointments you might be making or estimating your medications based on current numbers. Number 2, get added to a family member's plan. For a lot of people, the health insurance provided by the employer is the cheapest possible option they have. But this doesn't necessarily imply that the employer should be yours. You might have a spouse or a parent who has health insurance. You should definitely compare the prices of getting your own health insurance to the cost of getting added to their plan. If getting added to a family member's plan is more economical, you can save money on health insurance that way. Number 3, using a health insurance broker. Well, it is not always the case that the marketplace has the right prices, and you might also have some difficulty navigating the marketplace on your own, which might make it a tad tough on you. So there is always the option of getting the help of a health insurance broker. A broker can help you compare the various plans that are there in the market. The fact that they work for various health insurance companies means that they have a telescopic view on the health insurance plans. Also, the fact that they work for multiple companies means that they will look for your best interests while choosing a plan. Health insurance brokers do tend to earn commissions, but it won't hurt to take a look at the myriad of plans that might be familiar with which you might not be informed about. Number 4, understanding the bands and curves in your plan. Learning the terms and conditions of the plan is another way to save money on health insurance. In the various plans you are looking at, you should factor in the things such as copay, lifetime maximums, deductibles, co-insurance, etc. In a variety of health insurance plans, you will end up saving a lot of money if you visit an in-network. There are various plans where you might end up paying all of the money in case you make a visit to an out-of-network doctor or medical facility. Health-saving plans are also extremely beneficial if you are planning for the future. In a health savings account, you might have the benefit of making a tax-free contribution and withdrawal when it comes to healthcare costs. If you are someone who generally stays healthy, then a high deductible health plan with the health savings account might be a wonderful option. Number 5, negotiating service costs and discounts. If you are someone with a positive outlook on life and are looking to make the job of doctors, billing departments, or even medical facilities easier, they might be willing to talk about lowering the costs. You might want to ask some questions such as whether you will be discounted if you pay in cash or if you are willing to pay in advance for future appointments. If you have other healthcare concerns, you can also share them with your doctor. There are doctors who will reduce their fees in case you issue such high deductibles, although we might not prioritize asking for discounts when we are sick. Always remember that saving every penny counts. Number 6. Find the ways on saving on your prescriptions. There are various ways that you can save on your prescription drugs. The safest ways is to have a lifestyle where you eat the right food, exercise frequently, and get proper sleep to cut out unnecessary medications or prescriptions altogether. But if that isn't really possible, you can save money on prescriptions by looking for the genetics of a medication. You can also surf the internet for finding the lowest price of a medication you are under. Certain income category people are charged differently as well. Pharmacies such as Walmart also have prescription saving programs. There are also mail order pharmacies where you can purchase medication in bulk at a discounted price. You might also be able to get discounts if you use the pharmacy savings card. Number 7. Unnecessary medical visits. We've all had visits to the doctor where we have later mused, was that really necessary, or could I have got along fine without paying for the doctor's fees? So you might really want to assess whether your condition merits a visit to the doctor or not. The U.S. Department of Health and Human Services, often abbreviated as HHS, has done a lot in recent years to expand the health service provided through the telephone. As a study has pointed out that the cost of attending to a doctor is 3 to 4 times more cost-effective than an in-person visit. You might want to check whether your health insurance plan allows you to consult a healthcare provider over the phone. Sometimes doctors also perform tests as a form of taking precautions, so consult your doctor to know whether they really think that the tests or procedures they are recommending you need to be carried out. Number 8. Take advantage of free resources. You might want to take a look around community clinics and see if they offer certain screenings for free. With the massive upsurge in the number of diabetics in the US, certain insulin manufacturers have made free or discounted insulin available under certain programs. However, finding free vaccines at community clinics is quite difficult. You might want to check at the state health departments whether they provide vaccines to uninsured adults. Pfizer, a vaccine manufacturer, has a history of offering payment assistance programs directed at children and the elderly. Number 9. Find out if you qualify for government assistance. Your income will dictate whether you are eligible for health insurance that is funded by the government. For instance, Medicaid or CHIP, Children Health Insurance Program, are some of the ways that the government assists you. Even if your income is higher than permissible for getting government assistance, you might still be eligible for premium tax credits or cost-sharing subsidies. The availability of tax credits and subsidies was something people across all income levels could make use of from March 2021, thanks largely to the efforts of the American Rescue Plan. Number 10. Review your insurance plan annually. After you have taken health insurance in a particular year, you can assess the improvement on your medical condition and see if your current plan will work in the future or not. If your medical condition has changed for the better or for the worse, you can always take a look at a new plan and have an open enrollment, which allows you to get enrolled to a new plan or change your existing coverage. All in all, there are a wide number of factors from which you can save money on health insurance. The easiest ones are where you can take advantage of the free resources and negotiating service costs with the medical practitioner or the institution. You might find the other ways of saving money on health insurance time-intensive, but they are often great when it comes to saving money. After all, time is money, or the other way around. Are there any other ways you have adapted to save money on health insurance? Please let us know in the comments down below so that others can learn from you. Before you leave, please give us a thumbs up on this video, and also don't forget to subscribe to our channel with the notifications button to not miss out on learning other areas where you can save money. We'll be on with a new video soon, but in the meanwhile, you can watch the video on the screen.